Skin tight is Cyton's skin tightening procedure. It refers to the use of broadband light technology. It's the infrared wavelength specifically that is used to deep-heat collagen, and it does actually work in two phases, basically to heat the collagen and contract immediately the bonds, and then over time that leads to remodeling of collagen and tightening of skin. I think when we talk about skin tight, we need to emphasize that this is a skin tightening, so we're going to have really a benefit to anyone because the fact that skin thins is an aging process. I like to see skin tightening as part of any kind of skin program, whether we are trying to treat skin for texture or for just rejuvenation in terms of fighting laxity, but in fact any patient can benefit from skin tightening as far as their long-term fight against aging. When I first started using the Skin Tight by Cyton, the traditional method really required that the heating without motion was much more uncomfortable. In order to get enough energy into the tissues to really see results, I really needed to decrease the amount of discomfort and give them a treatment that they would be willing to come back for again and again. I do think that if you use the motion when we get less discomfort, in fact to the point where now patients look forward to coming into a skin tightening treatment, it will be something that is really used to its maximum benefit because they have repeated treatments. There is an adapter now that goes on the IPL crystal of the IPL handpiece by Cyton, and it actually rounds the edges of the crystal, which is now above the base of the handpiece, so that not only blocks out light that comes from the side of the crystal, so that now as a treatment for the physician, you can watch what you're doing without worrying about a lot of flashback from the light. And you can also smoothly glide the edges, so you can roll the handpiece instead of having to keep it totally perpendicular. You can roll it a little bit up over curves so it comes up over the jawline. So it's just a little adapter, attaches to the crystal with a magnet, very easy to take on and off. I use it for all my IPL treatments now just because it's so easy to just get the benefit of what you're trying to do in sending light down into the skin and not scratch anybody with the side of the crystal. So it's a nice addition. Maintenance is really on an individual basis, but I do think that everyone would be encouraged to protect their investment and to continue to do skin tightening on possibly every 3 or 4 months, or more often if they choose to just make sure that they don't lose the benefits that they've received. The main reason that Cyton, I feel, is the best investment I've ever made is because of its quality and its reliability. I have really total confidence that the company produces the best product on the market, and if they can offer me the technology, I would always look to Cyton first. So what we're going to do here is demonstrate the motion technique now off the face. This is to see some of the crepey little fine lines and improve over the abdominal area. And what I wanted to point out as well is Skin Tight is an absolutely safe treatment. This patient has a little tan. It doesn't matter on skin type. It doesn't matter whether she has some tan. You can see where there's areas that are less tan. We can do Skin Tight safely on any skin type and with or without recent sun exposure. So we're going to begin by doing this whole abdominal area. We'll divide it into 4 quadrants, and this is Skin Tight off the face. So we're setting our settings for Skin Tight are 150 joules, 11 seconds for our pulse length, 150 joules delivered per pulse. I still leave off the post-cooling because there's no need for cooling with motion, post-cooling with motion, and I leave the temperature at 20 degrees. So those are our settings, and we're ready to go. So what we're going to do is try to improve the firmness and smoothness of the skin. And if you look carefully, you can see how these fine lines, which actually show much more when she stands up, are bothering her because her skin looks just creepy, and we want to have it smoother so that this actually softens and evens out this whole area. A great time to have skin tightening on the abdomen is after delivery, where you have that kind of stretched skin that just needs to snug back up, or certainly after liposuction where or our pro-lipo, where you're doing just maybe a little area of fat. You're going to get that nice smooth skin back over that surface of the abdomen that gives you a really natural looking smooth contour. So we're going to go ahead and treat her abdomen. We're going to be treating with the smoothie, and even though this area obviously doesn't have bony prominences or things that would bother you, you will see as we move just how easy with motion we can glide over the skin and not give ourselves any problem. So there's no discomfort from moving the crystal along the skin surface. So we'll start by warming a quadrant. These are our 4 quadrants. So this is 1. And usually in a big area, I will do 1 pulse just to let the patient kind of get the feel of it on each quadrant, and just to see just how sensitive any area is as far as, whether they feel any heat, or I see any pink surface changes. Usually with a larger area, in fact, it is less sensitive, and we can do smaller and more repeated passes. So that's showing our 4 quadrants. So 1, 2, 3, 4. So we just now are going to come back and see 1 quadrant a second time. And now I'm going to actually stack 2 pulses on the same quadrant to see if I see anything. And if you get some warmth or feel heat, you can say, I'm feeling it getting hot. Patients are, when you're off the face, very able to talk to you and tell you what they feel. So you can see a little bit of pink coming, but nothing too much. I'm going to do 1 more on this area, and then so we're going to do 3 in 1 quadrant. And that's getting that probably to the treatment level. So we're seeing the pink a little bit showing there. I'm still going to stay in fairly large quadrants. I'm going to do 3 pulses in this quadrant.